Welcome, everyone. We're glad you're able to join us for our virtual support group. Today, we have a very special guest who's been with us before, but every time he comes back, we learn more. It's Dr. Thomas Harding of the Maui Memory Clinic. And Dr. Harding, I guess we must have met probably 10 plus years ago. And he has a wealth of information about dementia and about things we can do to hopefully stave it off if we're worried about it. Dr. Harding is a licensed clinical neuropsychologist with over 20 years experience in the assessment and treatment of disorders in the geriatric and traumatic brain injury populations. He's the clinical director of the Maui Memory Clinic and has, as I said, presented here at the Caregiver Support Group. He also has personal experience as a caregiver, helping to take care of his father. Dr. Harding is widely engaged in community, both personally and professionally. And he is also a member of our board of directors. So we're really honored to have you join us, Dr. Harding. And I'm just going to turn it over to you and learn a lot.
Thanks for having me, Gary. Should I start my slideshow?
Yes.
Okay. Uh,
Yes, go ahead.
okay. So I was told that this is going to be on, current trends and what's going on with therapies, recent therapies that are being developed. So this is going to be a little bit different from what you see me talk about in terms of dementia prevention. Although if you have questions about that, I like to talk about that at the end. But I know this is for caregivers, and there's a lot of caregivers that are struggling with dealing with caregiving, and there's quite a few people out there that are looking for some kind of hope. And with this hope, there's a lot of snake oil salesmen, if you will, that are out there hawking all kinds of wares online. And I want to talk about some of that just to help you save your money. So let's just go ahead and start. I want to start with, okay, that's not doing anything. Okay. All right, so this is not, let's see if that'll work. Okay. I want to make sure we're all on the same page, first of all, when I use some of the words. I still get asked the question, is Alzheimer's different from dementia? So I just want to start real quick with the dementia pie. And the dementia pie is all types of dementia, and it includes Alzheimer's. And um, as you can see, the pie is divided up into different pieces, and don't really get hung up on the percentages because it depends on who writes the article, who makes the pie. It varies. I've seen Alzheimer's disease pies that are half, 50%. And then I see vascular dementia in here is 18%. And in my opinion, one of the larger pieces that we're seeing these days is something called mixed dementia. And that's where you have some Alzheimer's and you have some vascular disease. So those still seem to be the prevailing ones. These other ones, I have patients that have all of these frontal temporal. I see alcohol related. I have Lewy body dementia, Huntington's. I mean, it's all out there, but the ones that you'll see the most is the Alzheimer's and the cerebral vascular disease. And I'm asked a lot, so I just wanted to show this. How do I know if I'm having trouble? There's a whole bunch of stuff out there, like if you can't find your keys, things like that. This is something I saw that is relatively new that I kind of like because it doesn't just look at memory. It's talking about different types of tasks or functions you may be having trouble with, like if you're unable to learn a new task, well, that's mostly memory, so that's going to be more like Alzheimer's. Staying focused on a single task, that's more frontal, that might be vascular. Finding it hard to take part in a conversation, believe it or not, that might be a hearing aid battery. And if you just check them, it might improve your hearing. And we've got research that shows that hearing loss is a risk factor for dementia because we start to isolate. Mistake reflections or patterns for other objects. So something most of you guys will have to encounter is dementia with Lewy body, but people with Lewy body start seeing things. And if a patient says, I'm seeing reflections or I see something in the window, that's telling me this is a different type of dementia. And unusually sad, anxious, or frightened, lots of research shows that if you caregivers and their stress and their depression, if you don't manage it, it can lead to anxiety, stress, which can push you down the road to dementia yourself. So if people are unusually sad, anxious, or frightened, they're getting more than their fair share of stress in their brain, and that causes inflammation. So all of these are symptoms and signs that you might be on the wrong path. And so if you look at this next chart, we've got and all of us are going to be on one of these two lines, and hopefully you're on the yellow line because the yellow line, that's healthy aging. And if you look at this yellow line, it does go down, okay? And we're not going to be in our 80s and as sharp as we were when we were in our 40s. There's age-related decline. So we're all going to have some. The one you have to worry about is this green line that's going down, and it's showing it starting in your 50s. And by the time you get in your 60s, I see folks coming in and they're having what we call mild cognitive impairment. And I'll talk about that in a minute. But these are the two lines that we have here. So there's the healthy aging, which if you're having some senior moments and you're in your 70s, and if it's just the occasional senior moment, you're okay. All right. So we have this clinical dementia brain function continuum here. Okay. So what we have here are normal brain functions, and we do a lot of testing, and these are scores. If you went to school and you made 100 on a test, that's average brain function. That's where we like to see scores. Subjective cognitive impairment, that's a fancy word for senior moments. You may have one of those. You're sitting on the couch, you're thinking about something in the kitchen, you go in there, you open the refrigerator, and you have no clue why you're standing there. Okay. You don't have to be a senior to have one of those. Okay. But if those senior moments are really starting to become more frequent, I mean, we've probably moved down to something called mild cognitive impairment or MCI, which is scores in the 70s. You're not quite demented. If you can catch it, by the way, between SCI and MCI, pretty aggressive, you can make changes. And then we have, as we cross over the MCI into the early stage dementia, and then we have moderate stage and end stages of dementia. Okay. I put this in, and I'm trying not to get too technical, but there's something that just happened this past week that's pretty exciting. So I want to talk about these. And these are biomarkers. You probably have heard of blood and DNA markers and things like that that people are starting to ask their doctors for. And so if you look at this black dashed and dotted line, that's the beta amyloid that is associated with Alzheimer's disease. And as you can see, the accumulation of this starts back in your normal ranges, like in your 40s and 50s, okay? And then that blue dotted line, that's the tau, that's the neurofibrillary tangles. Those start afterwards as well. Okay, but if you look, you're still in the normal stages while this stuff is accumulating in your brain. Now, there's one on here that's not on this chart, but I'd like to just mention it, and that's cerebral vascular disease. So small vessel ischemia, capillaries not doing their job. We're getting lots of little lesions in our brain. Nothing large like a stroke, but something small that accumulates over time. There's been lots of research, even over here at the University of Hawaii. It shows this starts in our 40s as well. So that would be right between the tau and the beta. Brain structure, now this dotted green line, this is your actual brain structure. So when we ask someone to go see a neurologist or have their primary care physician order a brain image, the reason we do that is we want to see what's the brain structure looking like, okay? And that doesn't start making changes until later, as you can see. Now that solid red line, that cognition, as you can see, subjective cognitive impairment, it starts making changes, and then mild cognitive impairment. And of course, these other ones have already maxed out by the time we can look at your memory and go, yeah, you have Alzheimer's disease. So biomarkers have made some headway. And I've got a screenshot I'm going to show you next. But for optimal treatment, accurate diagnosis involves, and this is came from Current Medical Chemistry's 2022. This is it's pretty much the same thing we've been doing for quite some time. And it's just, the question is, do people have access to all of these things? So you may have asked, gone to see your primary care physician, say, I'm having memory trouble. He'll probably do a 5-minute little memory screen. And if you're not doing too good on that, he'll probably send you to someone like us that does neuropsych assessment. And the way the medical healthcare industry is these days, PCPs only get 15 minutes. You've probably been in there, and these days they're clacking away on their computer and they're hardly looking at you. And they're very tight, their schedule. So when you come to see us, we'll take about an hour and we're going to do a clinical evaluation. I'm going to get your history. I'm going to find out how you did in school. How many head injuries have you had? I've had many spouses go, I never knew you did that. Yeah, well, you never asked, so people really don't know until we ask. This laboratory evaluation, we're going to see your blood work. And now that we've got this new one that's out, we're going to look at we've got a new one that came out last week that's looking at the plaque and the tau tangle ratio. And this is pretty nice. We'll get into that in just a minute. Cognitive screening, you probably did that at your PCP's office or maybe your neurologist's office. The structural imaging, that's the brain mapping, or excuse me, that's the, looking at a map of the brain or the structures. And then there's neuropsychological testing. So to get a thorough evaluation, all of these things need to be done so you know what type of dementia you have. And this is the one I wanted to show you. The FDA clears blood test for Alzheimer's. It's the amyloid beta and the tau tangle ratio. And FDA just approved it. It came out May 16th. So hopefully it's not too expensive, so the insurance will cover it. But this is one of the first I've seen that I thought, well, finally we've got a good one. So I think this one can help people. It'll help you understand or help diagnose Alzheimer's, but it doesn't tell you anything about cerebral vascular disease, frontal temporal dementia, Lewy body, things like that. So even though you get this comes back and it's clear, you still need to find out if you have the other ones. Okay, so that would be the lab evaluation. We're going to talk about structural imaging a little bit. So when people get a brain image, we usually get a report, and it's going to tell us, what's going on. I'm going to spend just a little bit of time. I don't want to get too detailed here, but we've got what we call subcortical cerebral vascular disease here. There's mild. So looking at this, the top of the screen, that's the front of your head or brain, and the bottom's your back, ears on the side, and it's like we're looking top down, looking at the inside your head. And this white area right through here, this is small vessel ischemia. This is vascular disease. So this is a mild case. This person right here, by the way, these black areas don't belong there. So they've got atrophy. If you look at the other side of the brain, the joints are nice and tight. And it's open. And that's what we call cortical atrophy. This person here has moderate stages. This person probably has a hard time generating words because the areas that are needed to generate words are having a hard time communicating with each other because of the amount. This person over here with severe subcortical vascular disease, they have what we call aphasia. This person can't talk. This person probably doesn't understand a lot that's being said to him as well. So with this information, we can test people and we can correlate brain structure with what we find. So the neuropsych testing, what we're doing, you can think of it like this. So a neurologist is going to look at think of it like a computer hardware. You have a memory chip in there. You have a processing speed index. You've got memory cache, things like that. And what they're looking at is cranial nerves, and they're also looking at, is there any atrophy? What we do is we're looking to see how the software or your memory and your processing speed, how is it running on the hardware? So the way we do that, after you see a PCP and they give you a 10-minute screen, what we're going to do is the 2 to 3 hour testing. We're going to look at not just the tip of the iceberg, but we're going to find every little thing that's wrong in terms of function. If there's something not working, we will find it. And then, of course, we put that in our report. Um, and neuropsychology is a subspecialty psychology. I've got a background in neuroscience. I used to work with animal models and do a lot of neuroanatomy and slice and dice brains and look at things from a molecular level. But what we do, we don't slice and dice people. What we're doing is we're looking at test measures. So we apply standardized tests, and I compare your score to people your age because we have a lot of normative data. We look at things like language. Can you still generate words? Can you look at a picture and tell me what it is? Okay. Your attention. You have verbal attention and visual attention. So these are all different distinct tracks in different hemispheres. Memory, declarative, like can you remember a list of grocery items? Or can you remember contextual memory? These are all different systems. You have immediate and then 20-minute delayed, and that's the one really people are worried about if they have Alzheimer's. They have what we call rapid decay, and we'll give them a list of words 4 times, and then 20 minutes later, we'll ask them, do you remember that list of words? And they go, what list of words? Oh, okay, this is Alzheimer's. Okay, and there's verbal memory and there's visual memory. Visual perception and visual spatial construction. We're looking at the back right occipital parietal areas of the brain to make sure that's working just fine. Executive function. This is something that a lot of I do financial capacity assessments for people. Mom may not be able to make the best financial problem decision making, and so we do that a fair amount of that. And this is an important area because if you can't, well, let's say, can you live independently? Can you still work the items in your kitchen? Can you turn on the TV? Do you know how to use a phone? Can you pay your bills? Things like that. So that's executive function. Okay. So what we've been seeing here in Maui, we've been open since 2018, and I keep track. Well, I don't. Miley keeps track of the different types and the people that we have seen. And there's quite a bit of overlap between Alzheimer's and cerebral vascular disease. Now, over time, this piece in the middle has gotten larger. I'm seeing quite a bit of mixed dementia, and I'm always asking why. And I saw a study that came out May 27th of this month, and it's an association between the metabolic syndrome and young onset dementia. Now, if you're in your 70s and 80s, is with no surprise that you may have dementia, but young onset, 65 and below, I've been seeing more 65 and younger people coming in with memory issues. And so this metabolic syndrome, we're looking at measurements of the waist circumference, blood pressure, fasting glucose, triglycerides, and cholesterol levels. What that translates to is, what are you eating? And America has a typical Western diet is very high in processed foods, heavy fats, dairy products. And there's a lot of younger and younger people with this metabolic syndrome. And what this study found was metabolic syndromes associated with a 24% higher risk of all-cause young onset. So people are starting to have dementia younger. And I'm going, that's why I'm seeing more of these. I was wondering, I'm looking at the age and I'm going, wow, it's another one. When I saw this study, I went, okay, now I get it. Okay, this is a picture. I'm showing you this picture not to gross you out, but I want you to understand something because I'm going to be showing you some stuff, for treatment. There's a lot of things coming out on eBay and even on Amazon that they're trying to sell people that don't know any better, that are have some hope. They're hoping for hope. Can this be cured? And where there's an audience, there's a snake oil salesman. So I want you to understand something right now. This is a healthy brain. This is a front view. Like if I was talking to you, if you were to cut my face off from the ear to ear and remove the front half, So my ears would be here on the sides. This is the top of my head. My spinal cord goes down that way. Okay, so what I've got a pointer on right now is a hole. Now this hole is where this hippocampus is supposed to be right here. This hippocampus lives deep in your temporal lobe, and this is your temporal lobe. And as you can see, moderate to advanced stage Alzheimer's, the reason why someone asks the same question over and over, as a caregiver, you've heard this. They're not doing it to frustrate you. They're doing it because they do not remember what they just asked you just minutes ago. And the reason is this area, this hippocampus is gone. The cells that are responsible for encoding aren't there. So when someone's going to tell you we can reverse Alzheimer's, I want you to remember this picture because there's nothing to reverse. It can't be done. Okay. Now, this is moderate to advanced stages of Alzheimer's. Now, if we catch someone at mild cognitive impairment, subjective cognitive impairment, we get aggressive, and depending on the type of it is, if it's cerebral vascular disease, if it's pseudo dementia, if it's not a progressive dementia type, we can really slow it down. But once you've reached the level of losing 30% volume in your hippocampus, I haven't seen a study that says it'll come back. And I've been doing this for over 20 years. Okay. Um, vascular dementia. Now, vascular dementia, similar to Alzheimer's, these two black holes, this is where the hippocampus is supposed to be. This is advanced vascular dementia, by the way. And it can look similar to Alzheimer's. And that's why there's quite the overlap. And if you see your primary care physician and they do a quick screen on you and it looks like you're having trouble with memory, they may say, "Oh, you have Alzheimer's," and they may try to provide you with some medicine, but not really knowing, the type, because it's important to know the type of dementia because different medications help different things. And if it's vascular, you can get aggressive with it and stop it in its tracks. So uh, also with vascular dementia, if you look right through here, this is the area of the basal ganglia. There's lots of little peppers. None of these dark spots belong here. This is all damaged. And so basal ganglia is highly involved with your motor. So people with vascular dementia have oftentimes quite a bit of problems with motor control. They have falls and things of that reach. This is the area that's happening then. I put this one in here just to show you that it's just subcortical, but this is cortical stroke right through all of this area right here. This is not going to come back. Okay. All right. Now, the snake oil salesman been around since wax, right? These guys, they would sell, they show this is the elixir. It'll solve everything known to man. These days, the snake oil salesmen, they're better known as confidence men or con men, con artists, and they don't need a wagon train anymore. What they have is the internet. Okay, so they can go on the internet on any platform and put their wares up there and promise you the moon. And they stay in business because some people will try anything. Okay, and this is why they're still. Some of you guys have probably heard of Prevagen. I thought this died a long time ago, but lo and behold, I had a patient ask me about Prevagen last month. Prevagen, it won't hurt you, okay? But it's not going to improve your memory, okay? I think it's jellyfish protein or something. Now what they've done, I think they did this to stay out of a lawsuit. They said now with vitamin D, now that they put vitamin D in it, vitamin D is good for you. So they can say it improves, it helps. And so that keeps them out of court. This is another one I put in here, and I'm showing this to you so you don't buy it. I'm not telling you to look at this and go buy it. I'm telling you to stay away from this stuff. This is methylene blue. Okay, methylene blue. It's basically a blue dye. It's got FDA approval for treating several non-central nervous system diseases and illness. So central nervous system is your brain. Okay. This has been approved for treating non-central nervous system diseases and illnesses, okay? Animal studies, some clinical trials have demonstrated its potential to improve some cognitive function. Uh, Now, I have highlighted here animal studies. Anytime a drug is still in the animal study phase, it is nowhere near, we don't know enough about it to say it's safe for human consumption. We're still working on animals and giving it to them and then slicing their brains and looking at them. But they've had some success with cognitive function, oxidative stress reduction, things of that nature. Now, other studies have found adverse effects and safety concerns with methylene blue. So existing studies have limitations. These are small sample sizes, right? So the bottom line is further research is needed before you start taking methylene blue. We don't know how much you need, what's the optimal delivery system, how often you should take it, how long you should take it. We don't know any of that stuff. But you can go online, you can even go on Amazon and you can buy this methylene blue. I would not. I just wouldn't do it until we know more about it, just to be on the safe side. Okay. All right. Now, this next part is going to be just a little technical, but and the only reason I'm sharing it with you is so that you'll understand that these next things I'm going to show you go cost thousands of dollars. There's people hawking them online, and I want you to save your money. Okay. So this is a picture of a brain. This is the left hemisphere. The front of the brain is over here on your left. So this is your left ear over here. The left hemisphere of your brain is responsible for your language function. And a lot of people that come see me saying, I'm having word finding problems. I can't get those words out in time, you know. Okay, so that right through here, this is Wernicke's area. Wernicke's area needs to talk to Broca's area up here because between the two of them, they are forming language for you and they're sharing that information with your motor strip, and then it opens your mouth and you talk. Now, these regions are talking super fast to each other. This is a very basic drawing. And if you want to see what it looks more like in reality, it's a lot of connections, very complex connections going back and forth, talking to each other. Okay, now when they are doing that, you know, these different areas of the brain, they create brain waves. And basically brain waves different functions. So when you're sleeping, you've got these low function here at the bottom. This is when the brain's sleeping but doing maintenance activity, right? And then theta, this is involved in your temporal lobes. This is gamma waves up here. This is real fast. So the more squiggles you have, the faster it's cycles per second, okay? So the brain's creating different brain wave patterns. And as long as everything's working together, you know, they're in sync, everything's fine. If things get out of sync, we start having something called seizures. You guys probably know what seizures are. Well, seizures are brain waves that are not talking together the way they should. Now, the way we measure these brain waves is this electroencephalogram, or EEG. It's a cap. It's got lots of little places to connect wires to. Does not hurt. Okay. And the wires in the caps go in specific areas. So we've got the brain mapped out really well. Okay. Now, these EEG abnormalities, one of the good things that came out of this whole COVID-19 infection was we did a fair amount of research. And EEG studies have shown that the COVID-19, that's associated with the brain fog, in people with MCI, even months after the acute phase of infection. So we're talking about long COVID. Their EEG, they have EEG abnormalities. They have slowing of certain, or the alpha rhythm there. Okay, now, and we put together this panel and they've determined that COVID-19 and this ADRD, Alzheimer's disease and related disorders, I'm just going to call that dementia so I can get through this, okay? They have overlapping pathologies, okay, and neurophysiological abnormalities. So EEG abnormalities in COVID resemble those observed in early stages of dementia, brain fog. Go figure. It's the same situation. Okay. So it's good parallel neuroinflammation. neuroinflammation is getting a lot of press since COVID because it raises inflammation. So now people are thinking about brain inflammation more than they ever have. And let's see here. And it can be detected right here, detected by a routine EEG exam. So one of the things that may start being done in terms of diagnostic criteria is an EEG. And EEGs are everywhere. I've seen them in neurology office. They may have them in a PCP's office, maybe, but I know neurology has them. And that may be something they start doing as well, just to kind of look at those brainwave patterns. And I wanted to share this because I know a lot of folks are wondering what's going on in my brain with COVID. And the effects of COVID reinfection is something I want people to be aware of. So I want you to look at this dotted line that goes down. This is baseline. This is no COVID. You've never had COVID, okay? And then the green line is one infection. The red line's two infections. And the blue or purple line is three or more infections. Now, I've had in her late 40s. She's had COVID 6 times, and she has the brain of an 80-year-old. So, and I just tried to explain this to her. She went, I had no idea. So if you look at what happens with, let's say, your heart, cardiovascular system, one time, your risk is here. The second time it bumps up. Every time you get reinfected, your risks of problems with your heart goes up. Coagulation or blood clotting, a lot of folks with have COVID have had strokes. And here's why. Every time you get COVID, you have more coagulation. Okay. Diabetes, look at this. Fatigue, this is the one I see more than anything, people who had COVID. And every time you get COVID, the fatigue issue just keeps going up. Stomach issues, I see a lot of that. This is one I wasn't really tracking until I saw this study. I'm like, holy cow. Kidney function, look how far kidney function changes on COVID. Mental health, of course, neuroskeletal, pulmonary. Okay. So basically, the more times you catch COVID, the higher the risk of something happening internal to you. So just keep that in mind next time you're thinking about going to a crowded place without a mask or anything like that. Transcranial magnetic stimulation. Now, I showed you those brain waves so that you would understand what's going on here. This is transcranial magnetic stimulation. This is a large magnet in the shape of a figure eight. Okay, and they hold that just above your head. They don't rest it on your head, but they hold it just above. And then they run a current through there that creates this magnetic stimulation. Now, this is already FDA approved for people who have severe depression that do not respond to antidepressants. I've seen patients like this and I've referred them out. And I've seen it make a big difference in people's lives. So, and you're going, well, how deep can it get? So this area that's blue and red and things, this is axial view right here. You can see it penetrates pretty deep. And it's already FDA approved. So this is good stuff. Okay, so the con man, snake oil salesman, and knows just about this to put something together and sell it to you. Okay, snake oil. Here we go. Transcranial magnetic stimulation for schizophrenia, PTSD. And that's not all, folks. It fixes Parkinson's, insomnia, stroke, Alzheimer's, depression, brain atrophy, schizophrenia. This thing, I saw it online. It goes for about $4,000. So you take an unsuspecting person that doesn't really know much about this, and they go, wow, I think I'll buy it and put it on my head. Maybe it'll fix mom's Alzheimer's, or the Parkinson's or that stroke that he's had. It doesn't do anything except what we call a sham administration. So when we do studies with stimulation like this, we have a control group that gets nothing. We have the actual group that we're administering what we want them to have a certain frequency in a certain region. And then we have something called the sham administration. The sham administration is just sort of vibrating up there. It's not really giving you anything except a massage, maybe. But because you feel it, you figure, okay, I must be getting the good stuff. And because there's something called the placebo effect, so we're also looking at that. What this thing is administering is nothing but a sham administration. It's doing nothing but, well, it depleted your bank account maybe, but that's about all it did. Okay. Now, here's a field, transcranial electrical stimulation, or there's direct current and there's alternating current. And I've been studying this pretty close because I was about to buy some equipment and get trained in it and certified in it before the current White House administration came into light. You know, now that they're cutting budgets and stuff, this will not be available to you on your Medicare. If you're affluent, if you've got money to pay for it in the future, it'll be available to you. But this is the same EEG cap, and what we're doing is we're doing different types of currents and hooking this up into the neurotargeting software. So let's say you've had well, this right here is looking at your frontal lobe. This is probably working on the gamma waves. And this area back here is this is motor actually. So this would be motor for someone that's maybe had a stroke. They're trying to get used to their hand again. But the target regions and the software is they're making a lot of progress in it. I suspect by the time I'm old enough to need something like this will be available, but not through my insurance. It's just, I just don't, unless a new administration comes in and reverses all these things that's been going on with Medicaid and Medicare, um, this is not going to be available to most people. But why is it? This is doing quite well. Increasing brain gamma activity improves episodic memory and restores cholinergic dysfunction in Alzheimer's disease. So they're having some success. It's still at a point where it's in research mode. And I know this because when I was contacting the two different companies, they're going, you have to be associated with a university, you have to be doing research. So that's where it's still at in the research phase. But this will be out, I would say, within the next 3 to 5 years. This is going to be available. And they're having good success with it. They're still working on the targeting and how do you bring together the different high definition versus alternating current. High definition is getting really specific, and I was about to buy, I was going to pull the trigger on that high definition stuff and offer it to my patients until things changed. Okay. But because it's in research mode, the con man's out there and he's going, well, hey, why don't we just go ahead and make our own and offer this to people who don't know any better. So this is basically a plastic sack bowl with a strap on it, and they've got something in there that's going to tingle you, and they're going to charge you thousands of dollars for this. Okay. Um, People who don't know any better are going to spend big bucks on that. This guy, he looks like he's not so sure about this, but he, he's got the salad bowl in his head, and they've got this little device here that you can supposedly change things, but it does nothing. It's a sham administration. Okay, here's another one. Gary reached out to me. He sent me something, said, do you think this is anything to it? Phototherapy for age-related brain diseases. This is an article, by the way, by Dr. Steve Blake, who works at our clinic. He shared with me. He wasn't convinced that it's going to be doing anything, but I share his concerns. So still some challenges. There's been some success, but this is nowhere near ready to be interacted into care. I mean, you can buy it yourself. And so why? Well, how did this come about? So phototherapy, it was basically used and it still is being used in medicine for the skin disorders. So UV light is commonly used for skin conditions like psoriasis, eczema, and T-cell lymphoma. Okay, that all sounds good. Well, your skin, you can see it. How do you get that light into the past the skull? That's why that's a big problem. And they're looking at it. So here's something I wanted to say. Phototherapy is being studied. It's not anywhere near clinical use, but it's being studied for Alzheimer's and Parkinson's. And there's a push for some type of treatment for dementia because pharmaceutical companies haven't had much luck. We've got Aricept and Namenda, and we can slow down the rate of cognitive decline if it's Alzheimer's, but we just haven't really had much luck because dementia is multifactorial. It's not one part of your brain doing something wrong. It's coming from all different directions. So many things are involved, and one pill is not really going to do it. So now what they're doing is they're trying to do it, they're trying to manipulate those brain waves, and they've had some limited success. It is nowhere near ready to be used. And in fact, this study says it outlines the limitations, okay? But that does not stop the con man. Here we go. We have here a brain injury infrared helmet. Now, this person, this is a pretty ballsy person, if you ask me. They're showing you an artery right here that's clogged, okay? And they're saying that this helmet with some infrared light on it will clear it right up. And I'm here to tell you, if that was the truth, there'd be one of these helmets in every doctor's office that you go to, because if you could clear out clogged arteries with a little bit of infrared light, there'd be no dementia, okay? So, but they're saying it cures Parkinson's and Alzheimer's and stroke. Okay, so the the snake oil salesman has no morals. He does have your money if you bought from him, though. I mean, the Barnum and Bailey from the circus, they were saying, "A fool and his money are soon parted." They work off that same mantra. They're just trying to uh, gain your confidence, and they know that you have this hope, and that you're in hurting. Okay, and they take advantage of that. Here's one. This is what Gary sent me. Now, this one has taken it a step further. You don't even have to put it on your head. You just turn it on, you put it in your room, wherever you're at. And this snake oil salesman that's smiling at you here, he's going, Beacon 40 supercharges my productivity, allowing me to work smarter, not harder. It stimulates those gamma brain waves from far across the room. So, uh, um, the bottom line, if it sounds too good to be true, it probably is. Save your money and don't give it to these people. I mean, as long as there's people out there afraid and are willing to. I had a patient just been about a couple of weeks now. Her husband, he's got dementia and a host of other things, and she wants to try that methylene blue. And I said, well, we don't have any studies that really support. We don't know how much dose to give him, how often to give it. And she goes, I don't care. I just want to give him something, you know. She's pretty frustrated. She really sounds frustrated at her wits' end. And if it kills him, it kills him. And I just tell her, talk to your doctor before you do it, please. So beware. They're everywhere. Okay. And I'm pretty much done. If you guys have questions about any of this, I can take them.
Oh, yes, yes, doctor. We have a couple of questions in the chat. And then I'll just raise a few more. And I'll also invite our caregivers, if you have a question, just put it into the chat, or you can use the raised hand function that is in the react button at the bottom of your screen. So going back to the good news of, I guess it was a week ago, about a FDA approved blood test. This question relates to that. How does blood work analyze the plaque buildup?
Yeah, so the plaque is not just in your brain. And so it circulates. And how much you have circulating is going to help us understand what you may have in your brain. So it's the same thing that they do blood work for when they're looking at genetics. So, your genetic, biomarkers, they are in your blood. Now, you could also, if you want to do cerebral spinal fluid and you want to undergo a spinal tap, you can certainly go through that as well. But that's pretty invasive. I don't know if you ever had one. I have. And I'd take a finger prick over a spinal tap any day. But yeah, it's the markers, they circulate through you.
And my understanding from what's been in the news is that the blood test is still only for advanced diagnosis. It's not going to be widely available, say, to a certain age group or something like that.
Well, availability is going to depend on your insurance and does it cover it. And then if you're showing signs, so if you're having memory problems, if you remember that one graph I showed you where these biomarkers start decades before you start having memory issues. So this new one is going to, if they suspect there's something going on, and if your covers it, you'll probably get it.
Okay.
With early onset, especially, usually early onset, there's a genetic component. 10% of Alzheimer's cases, there's this familial. But with this metabolic syndrome going on, we're seeing younger and younger people.
That's
So
very, very
I don't,
interesting, very
yeah.
concerning as well.